in width and anterior posteriorly, it is about 3 centimeters. The right Hello. Hello. Good morning, everyone. The topic for presentation today is surgical anatomy of PCNL and step-by-step approach. First of all, the gross anatomy. The kidneys are bilaterally paired reddish brown organs which weigh approximately 150 gram in male and 135 gram in female. The dimensions of the kidney are 10 to 12 centimeters into 5 to 7 centimeter. Anterior posteriorly, it is about 3 to 3 centimeter. The right kidney tends to be somewhat shorter and wider. And it is below left kidney as because of the liver compression, it is a bit to 1 to 2 centimeters lower than the left kidney. The renal parenchyma grossly is divided into two parts: medulla, outer medulla, inner medulla, and outer cortex. The kidney, unlike the adrenal medulla, unlike the adrenal gland, the renal medulla is not a continuous structure. It is divided into multiple distinct conically shaped, noticeably darker in color, which are called renal pyramids. The extension of cortex between the renal pyramids is called columns of Bertini. These columns are significant as the renal vessels traverse centrally to peripherally through these renal columns of Bertin. And in case of PCNL, the percutaneous access to the collecting system is made through the pyramid, thus avoiding the renal columns of Bertin and larger vessels within the renal columns of Bertin. This is a diagram showing the anatomy of coronal section of kidney, showing anatomy of medulla and cortex. Medulla is divided into distinct parts called renal pyramid. Tip of each renal pyramid is called papilla, which drain into the minor calyces. Then the kidneys are retroperitoneal organs, which are posteriorly associated with 11th and 12th rib, and also the muscles which are psoas, quadratus lumborum, and aponeurosis of transversalis abdominis laterally. The anterior relations of the kidney are shown in this diagram, which are adrenal gland, colon on the left and right side, and small intestine, and liver and spleen. These are the posterior relationships which show that upper 1/3 of both the kidneys are approximated to the lower part of the diaphragm. The orientation of kidneys are in such a way that the lower pole is in sagittal section. The lower pole is placed anteriorly, and the upper pole is a bit posteriorly. And in the frontal plane, kidneys are rotated in such a way that upper pole is medial and lower pole is lateral. Then the renal artery. Renal arteries, there are two renal arteries, right and left, and they course differently. The right renal artery moves a bit caudally, and the left renal artery is a bit more straight and as it enters the kidney. And because of the rotation of the kidney anteriorly, the renal arteries enter posterior, more posterior than the other structures in the hilum. Kidney renal arteries divided into segmental arteries, 4 anteriorly and 1 posterior segmental artery. This is a diagram showing that there is one posterior segmental artery which leaves the renal artery before renal artery enters the hilum, and the anterior segmental arteries are 4, which are apical, upper, middle, and lower. Between both the segmental circulations, we have a plane, Brodell's plane, which is relatively avascular plane, and all the PCNL puncture should be through this plane to minimize bleeding. Now, the safest place for percutaneous access to the collecting system is directly into the fornix, because this will avoid the interlobar and the infundibular arteries. The following diagram shows that segmental arteries, as they enter the renal sinus, as they enter the hilum, they divide into anterior and posterior circulation, and the segmental artery then divides in renal sinus into lobar artery. Lobar artery then divides into interlobar arteries, which give rise to arcuate arteries. Arcuate arteries give rise to interlobular arteries, which give rise to afferent arteriole, which forms the glomerulus. This is a diagram which shows orientation of kidney in a
Sorry everybody, due to some network error, na, This live meeting is now closed.